Hello there viewers, welcome to our channel, and in this video we will be discussing COVID-19 and I am joined by Dr. Lipita. Doc?
Hello everyone, I'm Dr. Lipita. I'm a senior resident medical officer at the UTH COVID isolation ward. I've been working there since the first wave, then I moved to Levi Mwanawasa, and now I'm back since we had the second wave.
Yes, sure, thank you for coming on our program. So now, what exactly is COVID-19? I mean, everybody must already have an idea, but please refresh our minds. Like, what is it? What is currently going on right now? Where are we as a country in the pandemic?
Okay, as we already know, I think we're almost clocking 1 year since the pandemic, and new research is coming up concerning what COVID is. But basically, COVID is a virus from the family of SARS-CoV that is causing the highly infectious disease, what we call COVID-19. There are different strains of COVID depending on which country, so that is still in discovery.
Thank you. So now, I'm very interested in knowing how exactly your day goes. What activities do you get up to on a daily basis?
Okay, as an SRMO, well, my day starts with me following up on the results of patients. Because of the understaffing, we have to follow up on the results for patients, especially the D-dimers, the CRPs, and the COVID results. Because once you test positive on the antigen, we also test for PCR. So I have to follow up for those results. If the patient was antigen positive and PCR is negative and has other underlying conditions, we send them to other wards, meaning that they're out of the wards.
Okay, all right.
So aside from that, that's when we don, and donning is also a process. We don following the infection prevention methods. After donning, that's when I start seeing patients. When I'm doing my round, I also do a round with the nurses so that we check the vitals, we check how they are saturating, and see if the patients have any other concerns that they want to address before we go to the next patient. Because with COVID, we cannot maintain full patient contact all the time, because infection prevention procedures involve us maintaining not minimal, but just adequate
Contact. Okay,
Yes.
okay. So then, after your round, what follows? At what point do you get on your meals? At what point do you get to leave the hospital? Because that's a very interesting part of it, I think.
Okay, we actually don't have a proper timetable, like the time to have lunch. It will depend on the patient load. There are some weeks that even the ZNPHI will announce that the tests that the number of cases that they have tested which are positive are not many. Those are the weeks that we don't have a lot of patients in the ward.
Mm-hmm.
But then the times that the patient load is high, there is nothing like lunch break.
What?
Start, see all the patients, finish, and then go home, because I can't see patients and say, oh, it's 12 hours, I need to go have lunch and come back. Yes, so we just see all the patients. After we're done, that's when we go have lunch and do whatever we have to do. Yeah, so in most of my daily activities, what happens is after I finish seeing the patients, I'll follow up with the investigations, because I also do my rounds with consultants and senior registrars, so I'll follow up with the investigations, the tests that need to be done.
Okay.
Yes, because there are other patients that may need, for example, for the patient to go to CT scan.
Yes.
I need to arrange that the patient goes to the CT scan with me, with a nurse.
Okay.
We call the ambulance and the oxygen department for portable oxygen if the patient needs oxygen support. We also need to call the EHT, the environmental health technicians, because if they go for X-rays, yes, if they go for X-rays, we need to disinfect the place. So that is what is done. So it's not an easy thing like how we do in the ward. You just write an X-ray form and say, you go for the
X-ray.
X-ray.
Takes, and then, okay, next day you have the results.
Yes.
Oh, really? That's very interesting, yeah? Now, I'm sure even the viewers are very much interested to know how this pandemic has affected you socially and psychologically. Briefly, can you just explain how, what changes have you made to your life, with this pandemic and having to work in the isolation center?
Well, I'm sure there are a lot of people whose lifestyle has changed. They have to adjust to the new normal.
Mm-hmm.
Well, for me, I can't go to church. I know there are other churches which are open. I can't go to other social gatherings because I know that I work at the isolation ward. I may be COVID positive but asymptomatic,
Yes.
so I can't just go out there and socialize with people like I used to.
Right.
And that is also something that I miss. I miss socializing with people. I miss going to places, but it's something that we are all adapting, whether medical personnel or people out there, though others are not adhering to the COVID guidelines.
Yes.
But it's something that I miss. I miss socializing with people, spending time with my friends without asking myself where they were, and always reminding them that, hey, you have to wear a mask. Where's your mask? You have to maintain social distance. Because I know there are other people who are watching this and they're saying, how come those guys are not wearing masks? Well, we are negative. We got tested and we're negative, and we are really sure and trying to maintain the guidelines.
The guidelines, yes. I mean, like, just to speak on the same, for me, I think socially, like my parents, I have elderly parents, and I have to minimize the amount of visits I give to them because I'm always, you know, paranoid. Like, what if I'm positive and then I go over there and you hug and kiss, and then it's like, oh, you give it to them, and then they're elderly, they have slimmer fighting chances. So, like, socially, I think everybody can say if they're not affected. If they're not infected, they're affected.
True.
Right.
Well, the burnout.
Yes.
The burnout is
Definitely.
real because of the time. You cannot actually know what time you're looking off.
Yeah.
I don't get enough sleep. I'm always tired of the time. Seeing patients, the PPEs are hot.
Yes.
Sweating.
Yes.
And you know, I'm really joking with the nurses to say, you know, with PPE you don't need to actually go home and bath. You just come. Apply soap all over your body and go see patients. By the time you're done, the
sweat has washed you. It has bathed you.
So I think it's the burnout that makes me sometimes feel demotivated. But I think what balances it is when I see my patients go home.
Recover and you go home.
Yes,
Yeah.
and when I see my patients, some of them will come back. I've met some patients on the road and
Yeah.
I know who you are.
Yeah,
okay.
that's the rewarding
I
thing.
don't know you, but oh yeah, you are my patient, you are my doctor at the COVID isolation. Now I'm fine. Look at me. So that actually motivates me, despite the challenges that we're facing.
So, Dr. Lipita, we're also interested in knowing why patients are affected differently. Like in the isolation center, I'm sure you've noticed certain differences. Could you share those with us? The psychological differences, and I'm sure they play a part on the course of treatment and management. So, what have you noticed, in these patients?
Okay, patients who have comorbidities, hypertensives, cardiac conditions, diabetics, are at high risk of being in the risk group of high mortality rates, and those without comorbidities are recovering faster than the ones with comorbidities. So I've realized that it's very important for us to take care of ourselves. I know that as a nation we're not keen on healthy eating, exercising, but it's very important. And speaking on the psychological aspect of it, a lot of patients feel abandoned because of lack of contact with their family members.
That physical contact.
Yes. They can't hug their family members, and they can't speak to them in close proximity. So it's something that is affecting them. Others feel like their relatives have abandoned them, or they've just dumped them at the facility and they don't care about them. And we understand that even the relatives are also scared because there's that part of self-preservation.
Oh yes.
This person is ill, I have to stay away from them, but they have to maintain a balance, and that is hard. And that isolation effect is making a lot of patients to be depressed. Others are feeling depressed. Others keep getting phone calls. Your auntie died of COVID. Your uncle died of COVID. That friend of yours died of COVID, and they feel like they're next in line to say, okay, I'm next. If my uncle, my auntie, my friend, that one is dead, what are the odds that I'll make it out alive? So every time we have to remind them that yes, we know that person succumbed to COVID, but bodies are responding differently. You're not that person. Your body is not functioning the same way that person was. So do not think that you're next in line to die. So it's something that we always have to remind our patients.
So, in a combination of, the medical aspect of treatment, medications and whatnot. So I guess what I'm picking up is that it's also important to offer psychological, treatment as well, because it's a whole, it's a whole thing.
Yes.
It's just a whole thing.
Yeah. Because I think we need to sensitize the public more about the importance of maintaining social distancing, but also balancing. There's a difference between social distancing and stigma. Because other people will say that ever since they got COVID, even after testing negative, none of their relatives have checked up on them. None of the relatives have called them. Others were saying, others have been complaining, because we have a post-COVID clinic.
Yes.
Others will come complain that no, people have been calling me, blaming me that I gave them COVID, but they didn't even have contact with me. They say, maybe that day, that was maybe 3 weeks ago, I met them, and then they're saying that I was the one who transmitted the infection to them, and it's causing a lot of wrangle amongst the relatives and the patients.
I think everybody who's watching will probably feel like, wow, they'll probably have a better understanding of what you go through, and that will, I hope, will inspire them, to just, follow the guidelines, keep safe, and, sanitize practice social distance, and just keep yourself safe. But you don't find yourself in the isolation center as a patient.
Yes, and always remember, have your mask. I was talking to my sister and she was telling me that nowadays a mask is part of her. She doesn't go anywhere without remembering the mask. It's like a mask it's like next to her like a phone. All the time she always has to have a mask on her side. So you must always remember to have your mask with you and have a clean mask. You cannot wear this mask for 2 weeks straight. You have to change. Masks are cheaper now. We know that masks were expensive when we had the first wave.
When it just started, yes.
But now they're cheaper, and there are also the cotton masks that are not really effective, but these are way effective than the cotton masks.
Yes.
But they at least do the job.
Yeah. No, I think, to summarize this, rather to conclude this video, I think it's also important for me to add on, that masks, right? Masks are very important. We need them. And when you wear a mask, it's not just about, the mouth, it's the nose as well that needs to be covered.
Yes.
Because it just defeats the purpose when you have it on the mouth and leave the nose out. If you're sick, you're going to spread your virus around. And secondly, even the sanitizers as well, now they're affordable.
Yes.
There's so many videos on YouTube on how you can make your own.
Yes.
So that's another thing that you have to you have to make the point that you can't leave the house without it. And I guess, social distancing as well. If you don't have to go out, then don't go. If you don't need to go out, then just stay home. You can have a few friends over and just hang out from home, but just really, social distancing is a real thing and you need to practice it.
Yes.
So coming to the end of this video, I want to say thank you to Dr. Lipita for joining us on this, this channel. I think we've learned quite a lot, and for that, thank you.
Thank you.
Hope to have you on another episode.
Yeah, sure.
Yeah. So, any last words?
Remember your masks. COVID is real, and please don't be selfish, because COVID is deadly, especially with those that are adults, immunocompromised, and with underlying conditions. Don't be selfish. Be a brother's keeper and follow the COVID guidelines and stay safe.
All right.